Hi, and welcome back to another episode of Wellness Chronicles. This is where we talk about all things diabetes, and we talk about how to change your lifestyle, your diet, your lifestyle, incorporate more exercise, and make a plan that is more easy and actionable to implement into your lifestyle, so that way that you are managing your diabetes, reversing your diabetes, and even preventing diabetes in a more sustainable manner. My name is Pooja Patel. I'm a diabetes educator and registered nurse from Toronto, Canada. Now, today in this episode, I thought we would talk about the most topical drugs that are on the market, which are the GLP1 agonist drugs, also known as Ozempic or Mounjaro. So these drugs are the weight loss drugs that everybody seems to be taking, and everybody seems to be raving about them for weight loss. Now, a lot of patients come and talk to me. A lot of people, even in the community, will ask me my opinion as a diabetes educator, because really these drugs, they are originally prescribed for patients who have diabetes for blood sugar control. But another sort of use of these drugs that have come about more recently is for weight loss. But let's dive deep today as to how they work, what they do, what it does to your body, and is it worth it for you as a person who does have diabetes, or as a person who does not have diabetes, to take these drugs for weight loss. Okay, so how do these drugs work? So there's 4 ways in which these drugs really help reduce blood sugar. So the first thing that it does is, naturally our tummies have released GLP1 hormones. And so when we eat a meal, these GLP1 hormones are released into our stomach. And so that triggers the pancreas to release the insulin, so that way it can take the glucose and put it into the cell. So that's basically what its major function is. The second thing that it does is it actually delays gastric emptying. So the digestion of food from the stomach into the intestines is much slower, so you feel fuller for longer. So that's the third thing, that you feel fuller for longer, so you're not hungry. And the fourth and the last thing is it actually suppresses the release of glucose from the liver. So naturally, when there's insulin in the bloodstream, the liver will release glucose into the bloodstream because there's insulin in the bloodstream. So it actually suppresses that function, so there's less glucose in the bloodstream itself. So as you can tell, these are great drugs for patients who require some help with glucose control, especially the main function, which is releasing these hormones, so that way it's preventing insulin resistance, only releasing insulin when the body requires it. So you know what, the ADA, or the American Diabetes Association, and Diabetes Canada, they actually recommend the GLP-1 drugs as a second line of pharmacological approach. So the first line, of course, is implementing healthy lifestyle changes, including diet and exercise. The first drug that is prescribed usually is metformin, and the second line of drugs, if the metformin is not working, are these awesome GLP-1 drugs. Now, the reason why Diabetes Canada and American Diabetes Association love these drugs, the second line approach, is because they do a couple of things. They're renal and cardioprotective. So what that means is, so there was a clinical trial done with 3 GLP-1 drugs. So semaglutide, liraglutide, and duraglutide. And it was actually concluded that these drugs actually reduce inflammation, that eventually reduces MACE-like events. So major adverse cardiovascular events like heart attack and stroke were actually significantly decreased in those patients who had diabetes and we're taking these GLP drugs. The second thing that it does is it's renal protective. So it actually protects the kidneys. How it does that is it actually reduces the protein in the urine. It actually improves the overall efficiency of the kidney as to how well that is actually filtering the blood. And it actually reduces blood pressure, which directly impacts the kidneys. Now, there is a huge study done called the LEADER study, and in that, liraglutide was studied, and it actually found that there was a 22% reduction of those people who had protein in their urine to develop chronic kidney disease. So that's actually quite significant. So basically what it did was it stopped or slowed down the progression of just protein in the urine to actually full-blown kidney disease. There has also been a lot of literature out there recently that SGLT2 drugs and GLP1 drugs, they actually reduce the rate of Alzheimer's disease. They actually reduce the progression of Alzheimer's disease in patients who have diabetes. So that's actually great because we all know that sugar in the brain is called dementia. So what do you need to look out for when you're taking these drugs? So the very first thing is these drugs, whoever is taking these drugs, it leads to loss of lean muscle mass. So if you see patients with Ozempic face, that is because they are losing the muscles, the lean muscles that they need for functionality, they need to use for regular daily life. So what is recommended? So what I recommend and what is recommended is people who are taking GLP-1 drugs should take 0.8 to 1 gram per kilo per day of protein. So if you are a 50 kilo person, you should take at the very, very least 50 grams of protein per day. On top of that, to maintain the muscle mass that you already have, it is recommended that you also lift weights or do resistance exercises at least 3 times a week for 30 minutes. So this is to prevent any further loss of muscle and just to maintain what you have, because this is one of the side effects of the drugs. Now, the second thing that happens is you get an upset stomach. Although our body makes this naturally, but when you're augmenting it, when you're supplementing and putting more of this drug in your body, it only amplifies those unpleasant sort of symptoms in your stomach. So nausea, vomiting, diarrhea, these kinds of things are quite common in patients who do take these drugs. So that's another thing to sort of watch out for. Now, there were studies done with liraglutide, semaglutide, and duraglutide that suggests that patients who have a family history or themselves have a history of thyroid issues, they should stay away from these class of medications. Also, those patients or those people who have pancreatitis, gallbladder issues, or even gastroparesis or the slowing of digestion, they should also stay away from these class of medications because it's contraindicated. It's not good for those who have these conditions. Now, do I recommend these drugs as a diabetes educator? So I do, especially for patients who do have type 2 diabetes, because there is research, there is tons and tons of research that suggests that patients who do take GLP-1 drugs, it actually does reduce insulin resistance, and it does help make the patient as normal glycemic as you want them to be within the defined limits for that particular person. Also, it is great for your 2-hour post-meal sugar. So it actually brings the 2-hour post-meal sugar down quite well, which again contributes to that insulin resistance or contributes to that increasing insulin sensitivity for those who struggle with that. Additionally, because it does lead to some weight loss, it actually will also reduce the insulin resistance. So because you're losing weight, you're decreasing insulin resistance and increasing insulin sensitivity. That's the entire formula of these GLP-1 drugs. Do I recommend it for patients who do want to lose weight? So for example, if you have a patient who does not have any blood glucose issues, who does not have any issues with glucose control, do I recommend it? Well, I do and I don't. So I always would recommend to every single person to implement intensive lifestyle methods first. And if that is too difficult for them, they should also implement mild to moderate lifestyle modifications, if not intensive, and also take the Mounjaro or the Ozempic. And the reason why I suggest this, especially if a patient is overweight or obese or morbidly obese, because if you are obese or morbidly obese or extremely overweight, the benefits of losing the weight outweigh the side effects of taking these GLP drugs. So I think it's really, really important to note that. But at the same time, implementing lifestyle modifications is also very necessary. You can't take the GLP-1 drugs and not do the lifestyle modification. They have to be together. Having said that, did you know that there is a way to actually boost the GLP-1 drugs in your body naturally without taking those drugs, so that way you are losing weight and you are combating insulin resistance? There are a few methods that really work and that are proven by evidence and that are scientifically sound. So the first thing is, you might have heard this many, many times. Ever since you were little, you might have heard this, your parents telling you to chew your food. So the reason for chewing your food is exactly this. So first of all, chewing your food helps your body, or gives your body that time to release GLP-1 drugs, so that way the insulin from the pancreas can be released in enough amounts. Because if you're eating so fast, first of all, your brain doesn't think that you've eaten enough because you have eaten so fast. Second of all, it's not giving your body enough time to release those appropriate hormones, and then there's an influx of insulin into your bloodstream. So even though you've eaten, you're still feeling hungry. It actually reduces your post-meal sugar, which then reduces your A1C, and overall, you're reducing your insulin resistance. So anyway, it's a win-win. The second thing that really works to secrete GLP-1 drugs naturally is lemon extract. So taking lemon extract, or more particularly aerocitrin, will actually increase your stomach to stimulate more GLP-1 drugs. So you can take lemon, or you can drink lemon juice, but you have to drink a lot of it. So the alternative is to take a supplement of this, and taking a supplement of this every day over 3 months actually increases your GLP hormones by up to 22%. Another way is to have high protein meals. So things like eggs, fish, chicken, tofu, Greek yogurt, nuts. These things, they actually release GLP-1, and it actually not only causes satiety in your brain and in your stomach that you've eaten, but it also promotes a hunger satisfying hormone called PYY that further promotes satiety in your brain and in your stomach. So plating a balanced plate not only helps you release these GLP hormones, but it actually also helps you keep full, and lowers your insulin resistance and lowers those A1Cs and 2-hour post-meal sugars. The third way to increase your GLP-1 naturally in your body is by eating resistant starches. So these resistant starches are available in things like oat, cold rice, cold potato, certain pastas, beans, legumes. These kind of fibers, they are actually resistant starches, and they have actually been proven to not only help your gut. So what it actually does is it keeps you fuller for longer because they have a lower GI value, so you can eat larger amounts, and it helps create a nice balanced plate. The second thing is it actually also helps release GLP-1 drugs, or GLP-1 hormones rather, and PYY hormones, which really causes you to feel satiated. It causes you to feel like you've eaten a good hearty meal. So your brain is satisfied, and so is your tummy. So this not only decreases your A1C, it also decreases your insulin resistance. Now, it has also been proven that about 30 to 40 grams of resistant starch, so consuming 30 to 40 grams of resistant starch every day, can actually reduce your fasting insulin levels. So if you don't have so much insulin floating around in your bloodstream, you are lowering your insulin resistance and increasing your insulin sensitivity. So resistant starches are great because they're low GI and they help with insulin resistance. So that brings me to the pro tip of this episode. As we have been talking about, GLP-1 drugs are great. Truly, our bodies make them because we know we need them. And supplementing these GLP hormones, certainly they do help, but there is nothing better than primary prevention methods. So, for example, even if you wanted to implement small changes so that way you are increasing your GLP-1 production, chew your food thoroughly, balance your meals with more protein and fiber on it. Maybe try to switch up one of your meals of the day to include more resistant starch, so it's low GI, it helps with gut health, and it increases those GLP and PYY hormones that promote satiety in your brain. So these primary prevention natural methods are really effective and should be used as a first line defense rather than taking those additional drugs like Ozempic and Mounjaro for weight loss, when really you can just implement these natural remedies quite easily and integrate that as part of your lifestyle. So thank you so much for listening to this episode all the way to the end. I appreciate it. If you have taken away anything from this episode at all, or if you feel like somebody can benefit from this episode, please do 3 things for me. The first thing is share this episode with one person, a family or friend or a neighbor, whomever. Share with this one person so that way they are able to benefit from this evidence-based information, so they are able to also live a happier, healthier lifestyle. The second thing is, if you took away anything, please like this episode, comment on it, let me know how you found this content so I can continue to make more. It's absolutely free for you to do that. The second thing is subscribe to Wellness Chronicles so that way I can make more content and I can bring more evidence-based information to you, so we are creating this happier, healthier community that is free of diabetes type 2 and insulin resistance. So until next time, please stay happy, stay healthy, stay kind.